Welcome to another episode of Hudson Health. My name is Dr. E.J. Akanyoli. I'm Chief Medical Officer at Jersey City Medical Center, a facility of RWJ Barnabas Health. Today, we're excited to talk about men's health. I'm so excited because men's health never gets its time in the sun. Most women go to their OBGYN doctor frequently. Most men traditionally have not accessed care quite to the same degree. So today we want to talk about prostate cancer, sexual health in men, screenings for every stage of a man's life, and all these ways in which men can access health care and remain healthy in our community. And who best to help me today than Dr. Adit Shah? Dr. Shah is a urologist here with us at Jersey City Medical Center in our very expanding scope of urological and all of the practices that we have here. Very excited today to talk to him about all the things I mentioned. We'll be right back.
No one plans on heart disease, but everyone should have a plan for it. We help patients of all lifestyles and medical histories plan for healthy hearts. We offer convenient screenings without judgment, hundreds of preventive programs, and women's heart specialists. And we're the largest cardiac surgery program in New Jersey. Make plans for a healthy heart with RWJ Barnabas Health. Let's be healthy together.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in one of our many high-rise towers. With amenities such as the on-site Newport Path, light rail, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Kohl's, JCPenney, Macy's, and Target. Morton Williams and Acme Supermarket are just outside your front door. A health and fitness center, skating rink, and medical facilities are also on site. Enjoy the New York skyline from our waterfront and various parks. Manhattan is just one pass stop away, or a quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Looking to visit? Stay at the Westin or Marriott Hotel. For more information, visit us at newportnj.com. Make lasting memories to cherish forever. It's incredible. It's you, Newport. Live like you want.
Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights. Your one-stop store for residential and commercial floor treatments. Carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants. All major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Welcome back to Hudson Health. My name is Dr. E.J. Akanyoli. I am Chief Medical Officer at Jersey City Medical Center, a facility of RWJ Barnabas Health. Today, I'm very excited to talk about all things men's health with Dr. Adit Shah, one of our spectacular urologists here at Jersey City Medical Center. A couple of things I'd like us to talk about today is misconceptions, the common misconceptions around men's health. When to seek care, what conditions to seek care for, and also the stigma, if you will, around sexual health and dysfunction in men. More importantly, we think men should be getting advice from their doctors, and too often, when that doesn't happen, there is a void out there that people try to fill. We'll also want to talk about urinary problems, urinary incontinence, etc., and all those range of problems. Now, traditionally, women are the healthcare proxies of their family. So there is a little bit more ease when women access care. They take their children for immunizations, not uniformly, but we found in healthcare that there is a big need, especially in our community, for men to be able to access resources, follow up with doctors. So I'm really thrilled today to talk to Dr. Shah. He's come to us at Jersey City Medical Center for the past 1 year and has been an invaluable member of this group. Looking forward to it. I'll be right back.
Comprehensive healthcare is here, here, and here. RWJ Barnabas Health is healing, enhancing, and investing in Hudson County with its 2 newest locations, Hoboken and Exchange Place. Within walking distance or accessible by mass transit, our locations combine convenience with primary and specialty care, including cardiology, women's health, orthopedics, cancer care, and more. Let's be healthy together.
Panapinto Properties, Jersey City, shaping the workplace with state-of-the-art office spaces and addresses your company desires. Building residences that define your home environment, adjacent to all modes of transportation with on-site parking available. The right address, the right lease. Call 201-521-9000 or visit online at panapintodevelopment.com. Panapinto Properties, building Jersey City for everyone.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design studio and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Welcome back to Hudson Health. My name is Dr. E.J. Akanyili. I am Chief Medical Officer at Jersey City Medical Center, a facility of RWJ Barnabas Health. And today I have the unique pleasure of welcoming Dr. Adit Shah. Welcome, Dr. Shah, as a urologist at Jersey City Medical Center. Welcome, and tell our viewers about yourself.
Thank you, Dr. Akanyili. It's a pleasure to be here. Thank you for having me on the show. I'm a urologist who specializes in robotic surgery, and I'm uniquely passionate about approaching kind of urologic disease from a more holistic and patient-centered and family-centered perspective. And I unfortunately went through it on the other side. My mom had bladder cancer, and in navigating her having that disease and kind of our doctor's visits, I really saw how important, the family aspect and the social aspect and everything that happens, not just in the treatment that we give as surgeons and physicians, but kind of the diet, the exercise, the sleep, the whole picture of what goes into, urologic health. And I'm very passionate about bringing that to each one of my patients.
Thank you, and I'm sorry to hear that. So you have a unique role, not just in holistic care, but also in men's health. Can you tell us more about that and the role of screening, what screenings men should get at different stages of their lives? Yeah,
that's a great question, because I think, look, and I say this as a guy, right? We're horrible about taking care of our health, right? We don't see doctors, we don't get screened, we don't do any preventative measures, and really just when alarm bells come up, then we come to the doctor, and that's not the way to do it, right? So, starting in your 20s and 30s, you should be getting kind of basic checkups, which include cholesterol checks, blood pressure, blood sugar, basic labs, STD checks if you're sexually active. Starting in your 40s, you want to kind of focus a little bit more on your testosterone levels, more metabolic health markers, things like that. And then really starting in your 50s is when prostate and colorectal cancer screening should be done. And then, really focusing on cardiovascular risk and getting the lab work and having those discussions with your physician. But obviously all those things change if you're at higher risk, right? Which, we'll talk about.
So that's really important. So 20 basic lab work, et cetera.
Mm-hmm.
Then 40s, you want to think about metabolic health and testosterone.
Exactly.
And then 50s is when people need to worry about prostate cancer. And
yeah, I mean, so, this has obviously become a hot topic, right?
Yes.
Right now, as our former president, unfortunately was diagnosed with prostate cancer, advanced prostate cancer. And, this is I think I was just on an expert panel at our Cleveland Clinic meeting on the future of PSA screening. And the thing is, the guidelines state that PSA screening should be done from, 55 to 70. And there was even further confusion based on old kind of, this recommendation by this U.S. Preventative Task Force about not screening for prostate cancer at all. And it's kind of muddied the waters, and look, I just want to make this very clear, right? Because I think it's very important for physicians and patients. PSA screening is extremely important. PSA screening should be done every year or every other year if you're 50 to 70 years old. But that's even increasing, right? If you're over 70, they made that cutoff because the life expectancy was less than 10 years. But if you're a healthy 70-year-old, 80-year-old, 90-year-old, and you have greater than 10 years of life expectancy, which we're seeing more and more these days, get screened for prostate cancer. Additionally, if you're, younger, if you're in your 40s and you have a family history of prostate cancer, or if you're African American race, you're at higher risk for prostate cancer. So you should start getting screened earlier as well.
So I think that is so important. It just bears repeating, just very succinctly.
So important. So get a PSA every year or every other year, starting at 50 to at least age 70, and then have a shared decision based on kind of your health and life expectancy with your physician. If you're at higher risk, prostate cancer history in your family, or African American race, you should start getting screened at 40 years old with your PSA.
That's fantastic. So we've talked about PSA, which is out there in the news. And of course, we wish the former president the best of luck in his recovery and his journey, of course. We want to talk about advancements in prostate cancer, right? You just talked about screening, but tell us a little bit more about treatment. We obviously want to get people at lower stages, but what happens when they're in different stages of prostate cancer, and what are the treatment modalities we're seeing?
Absolutely. So, and I want to kind of just say, even in terms of screening, right, we want to catch patients who have more advanced or higher aggressiveness prostate cancer. So actually, even in terms of screening, we have MRI testing, biomarkers, and genomic testing that we're utilizing more and more too as an adjunct to PSA screening. And I just want to kind of mention that as well, because there are a lot of modalities and options we have nowadays, which is great. And then in terms of treatment, it's been a game changer, right? I am a little bit biased because it's my specialty, but robotic surgery has changed the game in terms of prostate cancer treatment surgically, right? Where in the past, we were kind of looking into a hole in this operation, and the muscles for that hold in your urine for continence, and then the nerves for erectile dysfunction were kind of hammock the prostate. So there'd be high risk of incontinence and erectile dysfunction. Now with robotic surgery, we're able to zoom in on these nerves and tease them off using very precise tools. And the outcomes have improved dramatically in terms of surgical treatment. For radiation treatment, we have more focal therapy and things like that, in terms of radiation options. And then now we're starting to look at more targeted therapies that may just target the cancer itself and not the entire prostate, although these really haven't been validated yet, so we're using them sparingly.
That's really interesting. And we do have all those modalities at Jersey City Medical Center?
Yes, we do. Yeah.
No, that's exciting.
Yeah, and we offer all of them. Yeah.
And we can always look at our website for all the services that we offer. Our goal is to make sure that people in this community have a one-stop shop,
of course,
that they can come to for care.
Of course.
And we have different clinics as well, where people can come in if they're not sure for testing.
Exactly.
So many questions, but in our next segment, we will come to talk about diet and exercise and what role it has in men's health. And then sexual health for men, which is something that, we had the whole show on why women never talk to their doctors, is perhaps even worse for men, and how the revolution in the care for erectile dysfunction, the whole spectrum of that. So we'll be right back.
No one plans on heart disease, but everyone should have a plan for it. We help patients of all lifestyles and medical histories plan for healthy hearts. We offer convenient screenings without judgment, hundreds of preventive programs, and women's heart specialists. And we're the largest cardiac surgery program in New Jersey. Make plans for a healthy heart with RWJ Barnabas Health. Let's be healthy together.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers, Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net. Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants. All major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Welcome back. I'm here with Dr. Adit Shah. My name is EJ Akanyeli. I'm Chief Medical Officer, Jersey City Medical Center. Welcome back, Dr. Shah.
Thank you.
So we left off last segment talking about diet and lifestyle as it affects prostate health, because you have a very big interest in the holistic sense of medicine. So tell us a little bit more what people at home could do to help their prostate health.
Yeah. So, I mean, look, I think this is why I'm so passionate and honestly a little bit, it's not just for prostate health. This is just for everything. And it's so easy, right? There's 4 pillars of a healthy human being: diet, exercise, sleep, and stress management, right?
I need the sleep pillar. Okay.
Yeah, exactly. We all do. But, so I think that getting a good night's sleep, right? 7 to 9 hours, again, if you can, exercising, 30 minutes of light, moderate exercise a day is what's recommended.
And walking is okay. It doesn't have to be vigorous exercise.
Exactly. Stress management, that's something, especially us Americans, we're horrible at this, and it's ignored a lot, right? But mental health stress, interpersonal stress, having a robust social network, right? Making time for your robust social network. Spending time with loved ones, right? Easy thing, but this affects our physiology directly, not just our mental health. And finally, diet, right? I think there's so many misconceptions about what's healthy to eat and what's a healthy diet and all these dietary fads. And I get really frustrated by it because I don't think it's that complicated, right? We know that a Mediterranean diet has no processed food. That's, I think, the biggest thing we're learning in this, modern society is processed food is killing us, and we need to decrease the amount of processed food that we eat. Lower sugars, right? Less meat, honestly, especially red meat, right? We eat way too much meat compared to what our body needs. Decreased alcohol, tobacco, obviously. And just nutrient rich, so more fruits and vegetables and just colorful fruits and vegetables, cooked in healthy fats. And that's really, it's straightforward, and not eating too much. And those are the basic tenets. I think if everyone followed that, we'd be much healthier.
I really like that. Diet, exercise, sleep, and stress reduction.
That's it.
Not as complicated, but something that we need to incorporate, especially in a medical advice.
Yeah.
So what are the misconceptions that people have in general about prostate health?
Yeah, I mean, one of them is the PSA, right?
Yep.
And I want to just bring that up one more time. The PSA testing is important. We see that it's very relevant to our news today, but it's something that's been there forever. It's a validated test. Get your PSA checked if you're in the age range and have that history. And then also urinary symptoms, right? I think, as I mentioned, men in general ignore their health until it's too late, right? Until they can't pee at all. Oh, my stream is a little bit weaker. Oh, maybe I had one urinary tract infection and that's not a big deal. No, weakened stream, not able to empty your bladder completely, burning on urination, urgency, feeling like you have to get to the bathroom immediately, waking up a lot in the middle of the night, going to the bathroom a lot during the day. These are all signs that you have an obstruction, your prostate most likely, of your bladder emptying, but that's not just a quality of life thing, right? It affects, if you're not emptying your urine, you're gonna get higher risk of infection, stones, and then over time your bladder wears out, and then your kidneys get shot, and people can lose their kidneys and have to go into dialysis because of it. And so these are things. If you have urinary symptoms, if you have blood in the urine, especially, come see a urologist.
That's really profound, because I think way too many people think it's a lifestyle problem. It's a little nuisance.
Yeah.
But blood in the urine, as an emergency physician, I've seen kidney failure from ignored urinary symptoms.
Yeah.
And the message is, if you're in doubt, or you're having any urinary symptoms, you really should see a urologist. And we have several in Hudson County.
Absolutely.
So I did have to end the segment by just talking about men's sexual health.
Yeah.
Right. Women don't talk about their sexual health. We find out men don't as well. And that's partly sort of society and taboo around sex and sexuality and bringing it to physician's office. So what can you tell men watching the show about how urologists can be part of that equation, so people are not looking at the internet or their friends, their non-medical friends, for advice? And then the stigma around erectile dysfunction still persists, unfortunately.
Of course.
So what are your thoughts?
Of course. And I think exactly what you said, right? I think anytime there's hesitancy and people are scared to bring up something in public, the issue doesn't go away. They just find alternate and poorer routes to kind of solve it. So, one of the biggest things I want to say about erectile dysfunction, kind of what I was saying about the 4 pillars of health, is that men often come maybe as their first time they ever visit the doctor because they don't have erections anymore. Sex is understandably very important to men. However, erectile dysfunction is often a symptom or the first visualization of your vascular health overall in your body. So your vessels that supply the blood flow to the penis are the same blood vessels that are supplying your heart, your kidneys, and the rest of your body. So even though you may just have erectile dysfunction, it may be a sign that you have poor cardiovascular health. So again, remembering that and trying to address it through the 4 pillars that I talked about, because all of those things affect erections as well. So yeah, diet-wise, right? Lifestyle, sleep, exercise, stress. But then aside from that, obviously, if this is refractory to those behavioral modifications, we have medications, and not just medications, lots of medications, not just oral medications, but intraurethral, shockwave, injection, and finally penile prosthesis if they're refractory to all that. So again, if you have erectile problems, you should see someone. Come in, see a urologist, get an expert's guidance that can kind of give you a whole picture and then kind of tailor your treatment specific to you.
And the urologist might be able to refer you to a vascular specialist if you need to, a cardiologist, or even sometimes just to start with your primary care doctor.
Yeah, absolutely.
Yeah, and we noticed that, especially in this community, the broad swaths of people that do not see their doctors, and especially men and younger men, there's an invincibility.
Yeah.
I did not know the statistics that will be the first reason people come into doctors, but I can see why. Because, the other things like diabetes tend to be more invisible, but this becomes a lifestyle problem.
Exactly. And so, again, kind of like the PSA that I just want to, men, please come in and get your checkups more often, see your doctor annually, get your blood work, get your testing done. It's so important.
Dr. Shah, it's been an absolute pleasure having you on this show.
Thank you so much, Dr. Akinwumi.
We'll be right back.
Comprehensive healthcare is here, and here. RWJ Barnabas Health is healing, enhancing, and investing in Hudson County with its 2 newest locations, Hoboken and Exchange Place. Within walking distance or accessible by mass transit, our locations combine convenience with primary and specialty care, including cardiology, women's health, orthopedics, cancer care, and more. Let's be healthy together.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in one of our many high-rise towers. With amenities such as the on-site Newport Path, light rail, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Kohl's, JCPenney, Macy's, and Target. Morton Williams and Acme Supermarket are just outside your front door. A health and fitness center, skating rink, and medical facilities are also on site. Enjoy the New York skyline from our waterfront and various parks. Manhattan is just one pass stop away, or a quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Looking to visit? Stay at the Westin or Marriott Hotel. For more information, visit us at newportnj.com. Make lasting memories to cherish forever. It's incredible. It's you, Newport. Live like you want.
Panepinto Properties, Jersey City, shaping the workplace with state-of-the-art office spaces and addresses your company desires. Building residences that define your home environment, adjacent to all modes of transportation with on-site parking available. The right address, the right lease. Call 201-521-9000 or visit online at panepintodevelopment.com. Panepinto Properties, building Jersey City for everyone.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Welcome back to Hudson Health. My name is Dr. E.J. Akanyuli. I'm Chief Medical Officer at Jersey City Medical Center. And I just had the privilege of interviewing Dr. Adit Shah, one of our excellent neurologists, and what a trove of information it was. Well, first, it was just a top screening for men at every age. And across his talk, we just kept hearing how important it was for men to get screenings. At 20s, routine blood work. At 30, start thinking of metabolic markers. And then at 50, really start thinking of the PSA. He talked about that, and other cardiovascular risk factors. The PSA was a big one. PSA, prostate screening antigen, you want to get that from 50 to 70 yearly. I know it's been in the news, and of course our hearts go out to the former president who's dealing with prostate cancer and publicly being a champion for people to get screened. Really interesting is Dr. Shah talking about diet and lifestyle modification, the 4 pillars: diet, stress reduction, sleep, exercise. Those things that we tell people are great for not only prostate health, but as we've talked so many times in this show, cardiovascular health, emotional health, etc. The biggest misconceptions around men's health is that, people don't seek help for things like urinary incontinence, blood in urine. Urinary symptoms are often overlooked, and he really talked about making sure you see a urologist for any of the signs. And then, of course, we ended by talking about sexual health and erectile dysfunction. Too often, men do not go see a doctor. And the moral of the story is please get checked. I've thoroughly enjoyed hosting this episode of Hudson Health. I leave you with one thing. Please get your screenings and please see your doctor. And we're here at Jersey City Medical Center and RWJ Barnabas Health to take care of all your needs and those of your family. Have a wonderful day.